Not all vaginal deliveries are traumatic. Let me just say that for the record. The first birth experience usually involves some tearing or lacerations, naturally occurring or given as a cut by the doctor called episiotomy and repair. But some just have skid marks. With that being said, recovery and treatment is not the same because one probably doesn't need any special care at all. Hello, moms and dads and future parents. Welcome to Mother Baby Central, your resource for great and practical information regarding pregnancy, postpartum, newborn care, and baby's first year of life. Since I mentioned earlier that patients who do not have intensive lacerations don't need special care, let me address the routine care first. After delivery, if the doctor said there are skid marks, meaning small tears without needing stitches, expect to have some slight burning when urinating. If you want to be more comfortable, use the ice packs for the first 24 hours after birth. The nurse will provide you with some of these ice packs and they usually last for maybe 20 to 30 minutes. So go ahead and use it, and probably after 30 minutes and you don't feel that it's cold anymore, remove and replace it with a regular pad. If you feel like you are bleeding heavier than the normal and experiencing a lot of abdominal cramping, remove the ice packs because it's not very absorbent and it's difficult to gauge the amount of bleeding with it on. So during this period, put a regular pad on and let the nurse check the pad every hour and measure the amount of bleeding that you are having. Ask for some pain medicine to offset the pain while you don't have the ice packs on, like a Motrin or a Tylenol. If your bottom feels better after 24 hours, then you don't have to do further care. Just make sure to clean yourself every time you use the bathroom to urinate by using the peri bottle and changing your pad. Put some warm water on the peri bottle and gently clean your vaginal and perineal area. Tap yourself dry and put a clean pad on. If the nurse gives you some Tux pads or some Dermoplast spray, then you can use those as well. So let's get on with care for moms who have first to fourth degree lacerations, episiotomies, sulcus tears, repairs, or with stitches. Tip number 1, ice packs is your best friend. The nurse will apply one immediately after birth. The cold will help with the swelling and pain from the laceration and repair. You have to use the ice packs religiously for the first 24 hours. It doesn't have to stay there all the time. Anyway, it only lasts for a few minutes. But put one on, I say every 4 hours. You still can use the ice packs after 24 hours for comfort purposes only. It soothes your bottom and helps make you feel a little bit more comfortable, so go for it. Number 2, use Tux pads, Epifoam, lidocaine lotion, or Dermoplast spray. Just like the care of a woman who don't have any laceration or repair, after you do your peri-care, apply most of these topicals or some of these topicals to your perineum every time you go to the bathroom. Bring the one they gave you at the hospital, take it home with you. The Tux pads and the Dermoplast spray is over the counter, so if you run out, you can always run to the store and get one. Tip number 3, use the Sitz Bath 24 hours after delivery. This will promote good blood circulation in your perineal area, it relieves pain and provide comfort, and speeds up the healing process. Use it 2 to 3 times a day, and if you can only do it once a day, do it at night. So doing a Sitz Bath is just soaking your bottom in warm water. There is a device used for it specifically, and the nurse will give it to you in the hospital. Don't forget to bring it home with you. Don't put anything on the warm water. No salt, no essential oil, nothing. It's just plain warm water. Soak your bottom for 20 to 30 minutes each time. A Sitz Bath is also useful and very helpful if you have hemorrhoids. Tip number 4, take your pain medicine. If you have a 3rd or 4th degree laceration, they can be very painful. So again, be on top of your pain. I'd say for the first week, take your pain medicine around the clock. Sometimes the doctor will give a prescription for a narcotic. Go ahead and take it. The medicine that the doctor prescribed are safe for the baby, so don't worry. Make sure you take it with food and drink a full glass of water with it. Tip number 5, drink lots of water. Keep on hydrating yourself. You will be constantly in the bathroom peeing. So this will remind you to empty your bladder all the time. Remember, if you're retaining urine in your bladder, this can cause urinary tract infection and you don't want that. Tip number 6, avoid constipation. So the tendency for women who have a lot going on in their bottom is that they're scared to have a bowel movement because it might be painful. Totally understandable. I get it. I had a similar experience. I had a 3rd-degree laceration for my first delivery and it's so painful. So be on top of it. Take the stool softener the doctor prescribed for you. Sometimes they'll give you a combination of a stool softener and a laxative. That is the one that really helped me. Drink lots of water, high fiber diet, fruits, vegetables, whole grains. Drink prune juice. I'm not a fan. I can't stand the taste, but I'd rather eat the dried prunes, so you can do that as well. Drink some warm tea. Whatever works for you, go ahead and do it. If you are loving this video so far, click on the like button and share it with your friends who you think will find value in our content. Let's keep moving to tip number 7. Walking. Walking is very beneficial to everyone, but especially to women who have babies, because women who give birth are at higher risk for forming a blood clot. Therefore, you need to walk to get the blood circulation going. While you're still in the hospital, try to walk in the hallway, in the morning, in the afternoon, in the evening, before you go to bed. It is a good form of light exercise. For the first 6 weeks anyway, moms, you have to take it easy. No heavy lifting, no strenuous exercise, and do very light household chores or none at all. Tip number 8, rest and take lots of naps. Your sleep routine will never be the same again until your child turns 18. No, I'm serious. Anyway, when your baby is sleeping, take that opportunity to sleep as well. Don't do any cleaning, cooking, or any of that stuff. Moms, I cannot stress this enough. You need to rest. Close your eyes, take a nap. Your body is still recovering and you need all the rest that you can get. Sleep when your baby is sleeping. Tip number 9, eat well, and I mean healthy, nutritious food. It is difficult to eat healthy, especially if your significant other doesn't know how to cook. So my suggestion is try to save some before you have the baby, put it in the freezer and eat them for later. Try to avoid fast food. If you are good at food prepping, do that as well before the baby comes. And freeze it. If you have food saved in the freezer, this will avoid constant ordering out, which also help you save money. Tip number 10, accept help from friends and family members. They can do some cooking, load some laundry for you, do some light cleaning, tidy the house, help with babysitting other kids if you have any. For dads or significant other, help mom with all baby tasks that you can do, like changing the diapers, burping the baby, putting the baby to sleep, and others. Support mom the best way that you can. Cook for her, bring her her favorite snacks, massage her lower back and her feet, bring her flowers, anything to make her happier and more comfortable. Tip number 11, nourish yourself mentally. Taking care of a baby is a big responsibility and sometimes you can lose yourself in it. Take a mental health break every day or whenever you can, but make it a priority. Go out for a few minutes without the baby, walk in front of the house, go outside to get a breath of fresh air, meditate, pray, meet a friend for a few minutes, read a few pages from your favorite book, do some light stretching or yoga or anything like that. Tip number 12, follow up with your doctor 6 weeks after having the baby. If you need to be seen earlier, call and make an appointment. If you are not feeling well, if you feel something is not right, probably a slight nagging headache that doesn't go away with Tylenol, epigastric pain, dizziness, or any other unusual symptoms, call the doctor right away. If your bleeding seems heavy, like soaking a pad in an hour, passing huge blood clots, lightheadedness, chest pain, cold sweats, worsening edema on the legs, fever, painful and engorged breast, call the doctor and report the symptoms immediately. If you feel sad for 2 weeks, having harmful thoughts towards yourself and the baby, unable to eat and sleep, do not have the energy to shower or do anything, not bonding with the baby, or feeling very anxious, please see the doctor right away. Dads, please take note of the symptoms of postpartum depression. If the mom is really depressed, she will not know when to seek help, so you have to monitor her for these signs. So there you have it, moms and dads. I hope everyone is finding great value in our topic for the day. If you do, click on the subscribe button. If you would like to know how to recover fast from a C-section, click on the link below. Happy watching!